Hello. Good afternoon, everyone. On the behalf of India IAP technical team, uh, on the behalf of India technical team, I welcome Dr. Kathy Sharma, ma'am. And the topic is today webinar topic is taping a boon to physiotherapists. We are live on IAP India YouTube page. You can subscribe to this channel for getting regular updates, or you can also follow our Facebook page. During the presentation, if any of you have any question to the speaker, you can put it in a question answer section. I request to moderator to please commence with the session.
Am I audible?
Yes, ma'am.
Okay. Good afternoon, a very good afternoon, and a very warm welcome from Ghaziabad team, IAPWC, to all our respected guests, seniors, and all the participants. I am Dr. Abhivyakti, Sub-Coordinator, Ghaziabad team. It's our second activity, and we hope we share an informative session with you all. Our resource person is Dr. Khyati. Our today's topic is about taping and how does it help in for our patients and sports person to recover from overuse and other injuries. Our chief guest for today is Dr. Pawan Saini sir. I hope he is joined or not. Hello, sir. Dr. Madhur, please ask Dr. Pawan Saini sir to unmute.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Dr. Pawan Saini sir, our chief guest for today. He's a senior, a mentor, a great friend, and above all, a very disciplined and dedicated physio who has his vision for the profession, by the profession, and to the profession. Over to you, Dr. Pawan Saini sir. Please.
Hello, are you able to hear me?
Yeah, Dr. Madhur, please check down the volume.
Sir.
It's a little bit less.
Yes, sir.
Okay. Should I continue?
Yes, sir. Yes, sir. Please.
Okay. So again, I will again start again. Good evening, everyone. Myself, Dr. Pawan Kumar Saini, convener IAP Gajat branch. First of all, I congratulate IAP WC Ghaziabad branch and IAP for setting new standards for updation of physiotherapy community. In last few years, Ghaziabad has emerged as a
ना तो
hub.
मुझे कोई दिख रहा है ना मैं किसी को दिख रहा हूँ। ओ भाई
Good afternoon, sir.
Again, some interruption was there. In last few years, Ghaziabad has emerged as a hub for physiotherapist education, physiotherapy education and profession. New standards have been set with physiotherapy colleges and IAP. Thanks, Dr. Monica, Dr. Priyanka, Dr. Abhivakti for inviting me as a guest of honor and giving opportunity to speak at this platform. I also want to thanks Dr. Khyati, uh, who has accepted to for this taping workshop. I wish all the participants for happy learning and enjoy this webinar. And in the last, I thanks Dr. Ruchi for creating this platform for the education of all the physiotherapists and students. Thank you, everyone.
Thank you so much, sir. Dr. Madhuri, could you please check down the volume? It's very less.
मैम वॉल्यूम बेसिकली स्पीकर की तरफ साइड से ही होगा, उनका मे बी माइक्रोफोन का इशू होगा.
Okay. Ma'am, should we start with our and then later on our guest, the chief guest can join? Yeah, so for our resource person for today is Dr. Khyati. She is a certified kinesiotaping taping practitioner from Singapore, a certified Mulligan instructor, practitioner. She has been former team physio with the Indian women football team, a team physio challenges trophy 2019. Presently, she is a mentor with SPA Sports Sports Physiotherapy at SPA India. She has an experience working with different Cricket Association, DDCA, Assam Cricket Association, National Cricket Academy. Over to you, Dr. Khyati.
Yeah. Hi, Abhivakti. Thank you so much for my
Thank you.
introduction.
Welcome to you, Khyati. I hope it's
Thanks so
a
much.
wonderful session with you.
Yeah. I would like to thank all the IAP Women's Cell Ghaziabad members for inviting me for this webinar. Hope I can help all of the participants in gaining some information about use of tape in sports as well as in normal population. And why I've chosen this topic today is because I feel like many of us feel that taping is only for sports. But my personal experience, I'll be sharing more today, that I came across with a lot of positive, feedback from people when I used it for general population, general patients rather than sports people. So let me begin my topic for today. Okay. Hello, everyone. Hope you are all staying safe and staying home. And I know it's a difficult situation, so we all can help by gaining some knowledge. Yeah. Am I audible clearly and am I clear enough?
Yes, ma'am.
Yeah. All right. So let's start this topic for today, taping a boon to physios. So what exactly is taping? It's a time-tested therapeutic method, uniquely designed because there are two types of tapes. One is elastic one and one is rigid one. There are many varieties of it, which I'll be discussing later. It enhances muscular, joint, and circulatory function. Can be applied at worn 24 hours a day, 24/7 maybe for a week also, because if you're using kinesio tape, which is the original one. Also used during rehabilitative and chronic phases of injury, acute, subacute, and chronic. It can be used as a preventive measure, and you can also collaborate your knowledge of other modalities like cryotherapy, hydrotherapy, manual therapy, electrostimulation, and acupuncture. Cryotherapy, as in the tape, is waterproof, like it is water friendly, so you can use it while you're applying ice. It dries up on its own. Hydrotherapy, if you're about to take a patient to any hydrotherapy pool or jacuzzi for exercises, this works very well. It dries up soon after. Manual therapy, I'll be discussing later. I have tried my own experience of mulligans along with taping. You can use different ways. If you're a mulligans practitioner, if you're a Maitland's practitioner, it depends upon you. Celiacs also. And electrostimulation, because it is good. This is good conductor of stimulation. This electricity. This tape also, when it is wet, you can use woven cloth dipped in water. You can put it, and then you can use IFT or any other modality you wish to use. Also, at times you can use those crocodile electrodes which are now available if you have used it before. And also acupuncture, if you can just lift the tape and you can use it for dry needling, or you can poke through the tape. It is completely safe. So why do we tape? It provides good support and blocks the painful movement. It re-educates the neuromuscular system. It reduces the pain, optimizes the performance. It prevents injuries if used appropriately, and make sure you have good biomechanical knowledge and you are thorough with your anatomical landmarks. Then only you'll be able to use it in a better way. It improves circulation and healing. And how it does that? The physiological effect. When the tape is applied on the superficial skin part, it lifts up and it activates the mechanoreceptors, creates some space for superficial fascia and lymphatic flow to be better. Like there is good circulation of blood and lymph from the area, and so the muscle has more space for contraction. And if you have to use some inhibition method, it works in the vice versa way. And it has good effects on skin, circulatory lymphatic systems, fascia, muscle, joint, ligament, and tendon. Now, there was a study in 2008 which says there are more densely populated mechanoreceptors in superficial facial layers than the deeper ones. So, tape exactly works on this principle. And how it works? There is stimulation of mechanoreceptors when you apply tape, which in turn activates your autonomic nervous system, which in further activates your intrafacial smooth muscles, hypothalamic tuning of global muscular tone, and so there is some good palpable tissue response. You can feel it while you are reassessing after putting the tape. You can actually assess and you can check. There is some good, instead of some resistance, you feel some good movement of the muscle. And this is how tissue manipulation is done through tape. This was given by Shilp R in 2003. And how the kinesiotaping works. It supports the muscle, it avoids injury and cramps, and thus it increases the range of motion. And the other function is removes congestion. This is very useful when you're using it for some kind of swelling in your calf muscle, or after ankle injury when there is profuse swelling on the lateral side of the ankle. It works very well. I have used it a lot. It avoids injury and cramps, increases the range of motion, further improves blood and lymph circulation as we just discussed, removes excess fat and chemical substances, and reduces the inflammation. And also, if you're using your biomechanical knowledge, you can correct the joint problems. For example, I would like to quote here. In cases of osteoarthritis patients, we usually have a varus deformity. So what you can do is, you can actually correct it by reducing the pressure on the medial side of the knee joint and load shifting to the lateral side. And also you can use the rotational component. You can apply one end of the tape on the lower end of femur, and you can go internally and you can rotate the tibia outwards. That is a very effective one. If some of you have done this kinesiotaping course, they teach that during their courses. And last one is activates the endogenous analgesic system, increases the range of motion and reduces the pain, thus reduces the inflammation. So you succeed in your treatment, training and rehabilitation, whichever part of it you're using. Now the basic physical benefits of kinesiotaping. It relieves pain, it reduces the swelling and inflammation. In turn, there is accelerated recovery from bruises and contusions. Usually in sprains, it speeds up the recovery by initially helping in reducing the swelling and inflammation. And for muscle spasms, yes, you can use the inhibition method. And for cramping also, usually in calf area, you can apply a web cut, which I'll be showing later. And so the overused muscles, if they're you put inhibition tape on them, so there is reduced in tone and thus speedy recovery.
I'm sorry to interrupt.
It supports.
Hello.
Yeah.
Yeah, Dr.
Yeah.
Khyati, I'm sorry to interrupt. Our chief guest, I think he's here. Dr. Madri, could you see?
All right. No worries.
Mr. Rohit Rajpal, he must be here. Dr. Madri? Dr. Himadri?
Yes, ma'am.
I think
Wait,
our
yes,
chief
ma'am.
guest
Yes,
is
ma'am.
here.
Yes,
Yeah.
ma'am. Yes, ma'am.
Dr. Madri, is he here? Yes. A
Yes.
very good afternoon,
Yes.
sir.
Good afternoon.
Good afternoon. Mr. Rohit Rajpal is here. Is a great name in lawn tennis. He has captained India's Fed Cup squad. He's a chairman with All India Tennis Association of Selectors, former number doubles pro. Presently, he's also a member of anti-disciplinary doping panel and president Delhi Lawn Tennis Association. Sir, it's a great honor to have you here. You can share your experience on on-field and off-field experience with taping.
Sure. I think the important thing is also to mention that currently I'm India's captain for Davis Cup.
Oh, thank you. Yes, sir. I missed that. Yes.
And no, I'm only mentioning it because so I played the game actively many years ago, and now that we are running the game or we are captains. Tennis always has non-playing captains. So for Fed Cup also I was a captain for about 4 to 5 years, and you know basically, and then now I've taken over Davis Cup. And the reason why I mention this is because over the years from my time, the changes that I've seen across sport now, how the younger players play, uh, the trainers that are traveling with us. So I'll give you a little bit of insight, of how sport has evolved, at least my sport. So from my time, in my days, I think, hello, can you hear me?
Yes, sir. Yes, sir.
Can I
Yes,
be
sir,
heard?
we can hear you.
Yes.
Yes, sir, we can hear you.
Okay. So I said from my time,
But we cannot see you.
I don't know why I'm not being.
There would be an option for the video. You must not have switched it on.
Normally I get a thing where
Yes,
can
sir.
you
Now we
hear me
can
now?
see
Yes,
you.
sir. Now,
Okay,
now it's
great. So from from my time, the way training methods have changed, and in my time, if I don't know if you remember Dr. Irani, there were, I think, maybe a couple of people who were known, and most of them were in Bombay, unfortunately. And Dr. Irani was one of them, a known physiotherapist. Then you had sports medicine, Dr. Anand Joshi. In Delhi, you had Dr. Chanchani. I don't know if anybody knows them. So these were very very nice people, physiotherapists. But training or curing professional athletes was very new to them as well. So as things evolved and people went on, uh, more and more techniques became necessary, because the sport became very very demanding as well, because the training, we were training for 6 to 8 hours daily. So I remember in my days, the only way to get around was that I traveled with the IFT or ultrasound myself, and I learned it from the doctors how to use it, and whenever needed, whenever it was needed, maybe at least once in at least I remember once in a week or 2 weeks, one of them had to be used, the machines, because if you're training daily, uh, 6 to 8 hours, you do tend to injure yourself or strain yourself somewhere or the other. So from those days to now, it's been unbelievable journey, I think, and progress has been unbelievable. So, for example, I'm currently traveling with some physios, younger guys who've traveled and educated themselves, who've done special courses in taping. Because today, if I pick a team, India's team, I pick a physio, sports physio, I definitely need to know what his qualifications in terms of taping is. So taping is such an important part of sports rehab that somebody who's not good with what they're doing definitely cannot make it to the national level teams. So that's how taping is, because on a daily basis, taping is required. When you're traveling with a team, somebody's injuring, somebody's training. So it's very important. And equally important is that, when you're playing in matches, these kind of things happen. You slide for a ball or you roll over an ankle. You need taping at that time to be able to finish a match. You don't want an athlete coming out or walking out and saying, listen, I can't continue, especially if it's a match for the country. So, so these young guys now, I must say, I must compliment them the way they have gone and educated themselves and are serving the country and the athletes now. Coming to taping, just so that you understand from a sports, as a player point of view, uh, taping, in our times when we traveled, obviously from India, there was nobody doing taping. I used to run into therapists from Australia, US, or Japan, you know, and we as Indians used to always go and take help from them. For example, if I strained a muscle or something like that, because these countries were rich, they could afford full-time physios traveling with their teams. So we would always go and look for help from these guys, and what they would do to us, for example, acupressure was very new, and the Japanese used their hands quite a bit and lesser machines. And I remember playing in England, in the suburbs, very windy and tough cold conditions, and I strained my quads very very badly. I couldn't move, and so luckily there was a Japanese team, and I requested them, and in 15 minutes the guy worked on, and he started pressing something in my foot, and I kept telling him, listen, it's my quad, not my foot. He's saying, just relax, and he pressed something and released my muscle from my foot, and then taped me. And I went on, and I was playing a very very top player called Medvedev, and I went on to beat the guy. you know uh, so that showed different techniques, where different people were using different techniques. And for example, now I see that every trainer or every physio who's traveling with professional teams carries at least 5 to 6 types of different tapes, at least 5 to 6 types, right? And that is because each tape has different tensions, different widths, and I've always been very inquisitive about a lot of things, so I like to educate myself, and hence these different type of tapes serve different purposes. So what I've learned through the years, and what I learned through now, is that when you're playing, the taping technique needs to be very very good with what you're doing. you know any kind of taping for that matter, if you, so this thing is good, but I think basic principles of taping, if you follow well, you should not go wrong. But when you're taping top athletes who are required to perform, you need to know your techniques, how you're taping, which tape you use, how much of tension to be applied, so that, you know, if the tension, for example, is not correct, then you will restrict the movement of the athlete, and he will not be able to go and finish his game. And so, you know, so functions of taping, obviously I don't need to explain, you're all doctors here, but for example, if I'm playing a match and I've rolled over my ankle and I've hurt my ankle, then the taping technique applied there would be very different. That taping technique would be applied so that I would be able to reduce pain, get movement, and be able to finish my game, as compared to when I've finished my game and I've gone back and now my rehab needs to happen. That taping would be very different to the taping that was done while I was playing a match. So in the other taping, the post-match taping would be that you would first analyze what caused that injury. Was there a muscular imbalance somewhere that caused it, or whatever it was? You would first go into the causes of that, and then secondly, then come to what kind of taping would be required for healing that, so that there is no, so you unload that injured area, and the athlete then gets enough time to recover. Am I being heard?
Yes, sir.
Can you hear me?
Yes, sir. Yes, sir. I hear you. It's a great insight, sir.
Yeah. So over the years, as I went along, I learned different things from different physios. Luckily, some of them were the best, because, you know, being in the professional circuit, you were always getting exposed to some of the best physios from the world, and I still continue to do so. So I've been very lucky in that department. So there's a lot to learn. You know, when these guys are doing things, I ask questions. I always want to learn what's happening. So I thought that I'll be able to share that. So taping, you know, like I said, there are many techniques to taping at the moment, and it's getting more and more advanced as to on-court performance taping or rehab taping for athletes. You know, a lot of the places I go, they only use one kenosis kind of taping, which is a very basic taping. But even in taping, things have really advanced. So you know, I mean, I think there's a lot of research needed in terms of further improving things. Great progress so far has been made, but I still feel there is room for further improvement. And I always encourage, you know, I think the future of doctors is here in this country, and if it's research based and functional based, I think there's a lot of innovation that you guys can come up with in this area.
Thank you so much, sir. Thank you so much for your valuable time. It's a great honor for us that you are here. Thank you so much, sir.
Thank you. Good luck, everybody.
Thank you so much, sir.
Thank you, sir.
Dr. Madhuri and Dr. Ruchi ma'am has joined.
No, no, ma'am.
Okay, over to Kathy.
Yeah. Thanks, Abhivek. And thank you, sir, for useful insight. That is why I wanted to actually talk about today. The basics of taping, how you should use and where you should use. That is very important. And he has already made it quite clear that how useful taping is, but you make sure that you use it correctly. So now, resuming back to my today's topic, the physical benefits of kinesio tape. The first and foremost is the pain relief and reduced swelling and inflammation, accelerated recovery from bruises and contusions. It prevents or relieves muscle spasms and cramping. It speeds up the recovery of overused muscles. As Sir rightly said, the muscular imbalancing, it works very well on that. Supports injured muscles and joints without restricting the range of motion. He mentioned it already. The improved lymphatic drainage will help minimize swelling and bruising of the treated issues, specifically in the muscle strains and ankle strains. The enhanced blood flow to the injured tissues supports more rapid healing. And the lifting action of the tape on the skin reduces the pressure on pain receptors, making both the injury and the effects of treatment less painful. Mostly the kinesio tape provides support for injured muscles or joints while allowing a full and healthy range of movement, an important component in rehab. The other ones, the rigid ones, it is difficult to provide the full range of motion. That is a restriction of the other taping methods. So there are basically four main taping methods. I have reduced them, and these I'll be putting emphasis on these four. The first and foremost is kinesio taping, that is the elastic tape. Complete range of motion can be provided. The prophylactic taping, conal taping technique, and dynaplast. So let's start with athletic tape. This is the tape. It comes in different sizes like 1 inch, 2 inches, and 3 inches, depending upon the use. We are using it for ankle, knee, or some bigger muscle group. The primary purpose is not rehabilitative. The initial purpose is for the acute injuries and injuries prevention. It has got limited wear time because after the session or the event, it gets wet and it causes some skin irritation because of latex adhesive in it. So it's better you remove it immediately after the event, and you have to reapply it again, the fresh tape. Requires a pre-tape and a spray adhesive because the adhesive quality is not that great. And definitely there is compression of the skin, joints and muscles. But in some cases, it is very useful if the player has just suffered from grade 1 or grade 2 ankle sprain, then you have got to use this. Kinesio tape will provide a treatment part of it. But to block the range of motion, you need to use athletic tape or meconal tape. Next is meconal taping. It has different companies which provides this tape. I won't be endorsing any of it here, but usually Endura and Leukoplast are the better ones. This is usually used for bracing or strapping. You put 2 anchors and then you have to do a crisscross thing, or you can go spiral, or you can put it in a fruit basket shape. There are different ways of putting it. Because of lack of time, I won't be able to tell you the different applications, but yes, you can search for it. This is extremely rigid. There is no movement at all. It is like complete blocking of movement. Like if you're putting it on ankle in neutral position, you won't be able to go in the plantar flexion. Dorsiflexion will be possible, the internal range. And requires pre-tape, this lower picture as you can see on your right hand side. This is for under wrap purpose, and the best one is BSN Medical Fixumal. That is the best one. It causes less of skin allergy, but it has got limited uses and limited wear time due to skin irritation and poor adhesive quality, just like the athletic tape when it is wet after sweating and all. Then is the dynaplast. It is a little better than the previous two if you need a little movement and at the same time a little blocking of the range of motion. It is mix of rigid and flexible. For example, if you're taking a piece of 4 inches and if you're cutting it longitudinally in the length of the tape, in the dynaplast, then it can stretch up to 5 to 6 inches, like 1 or 2 inches extension you can get. It is cheaper, yes, it is available, readily available at any chemist shop, provides good support as well. And it is quite common in cricketers. They use it for their finger injuries and their hand injuries, which causes when they have this direct contact with the ball. But it causes skin irritation for a longer use. So let's come to the kinesio tape. Why I support this? It's not just because I am a regular practitioner of this, but I have seen that it is easy to wear, like the longer wear time, 3 to 5 days. It is safe for pediatric to geriatric population. Like you can use it for toddlers and you can use it for elderly patients. There is very minimum skin irritation response. And this is latex free if you're using the original one. It is for rehabilitative purpose as well, works with body to allow normal range of motion. As you can see in the picture below, this one is on the shoulder is a deltoid tape. It is a bit longer. You can reduce it. Depends upon, again, your use. If you want to reduce the tension in the nearby fascia, then you have to use this longer handle. Otherwise, you can use a shorter handle. And this one is for rectus abdominis, then obliques, and your pectoralis major. And this is, they have given facilitation taping to sternocleidomastoid. It is common in contact sports when there is banging of heads and when there is contact or shoulder to shoulder movement, then it is very useful. This blue one, as you can see in the front of neck. And as I said, you can use it for virtually everything. Like for example, AC joint, your ACL injury, in the case of ACL injury, there is weakness of hamstring, so you can go for a facilitation taping during the treatment time. And if you have to put the player back into a match, if the injury is grade 1, not up till grade 2, you can go for inhibition tape, but you have to take precautions that. And biceps tendonitis, brachial plexus, carpal tunnel syndrome. I have not mentioned here tennis elbow, golfer's elbow. For headaches, if the patient has pain in the like short muscles of neck, like extensors, you can use the tape, to give a support to the neck. Or you can use snags and nags, like Mulligan's technique. Then for scoliosis, for postural correction, shin splints, and many more techniques. Now the application. There are two ways of taping a muscle, inhibition or facilitation. When you're facilitating a muscle, which is specifically to strengthen the muscle, you start from origin to insertion, that is proximal to distal you go, and you can apply tension 15 to 50% depending upon if you have to block the complete movement or you have to restrict it, depends upon the need of the patient. The second one is inhibition. That is to inhibit it. It goes the opposite way of the facilitation, insertion to origin, distal to proximal, and it is applied with a little lesser tension, that is 5%. I don't know how many of you have seen the tape, but this is how the roll is. So we usually cut the tape in the direction, like in the length of the tape. And by tension, what I mean is I'll just cut a piece of tape. I'll show this to you. See, I'll tear it apart, and if I'm applying this much of tension, this is 10 to 15%, then I can go 50%, and this is the complete. You can see how much we can go, how flexible this tape is. And I don't know whether you can see it or not, there are some lines, rounded lines there, they go in sync with our muscle structure. So that is how it works. Now these are the different types of taping, as you can see on your left hand side of the screen. This is the McConnell taping for the knee. They have used under wrap, and for shoulder also they have blocked the movement, complete blocking of movement. And in this knee taping, they have kept it in 15 to 20 degrees of flexion to avoid full extension. And in this shoulder case, as you can see, they have restricted the movement in 15 to 20 degrees of abduction. And in this, on your right hand side in the middle, you can see this is a kinesio tape. They have used 3 different types of taping here. The blue one, which is rounded around the deltoid. This is an inhibition taping for deltoid. Now this above one, this is for joint correction, and this is personally I have never used it, but this is basically to take the load off the shoulder, and they have transferred the load towards the back of neck, as you can see. This going from this portion towards up, so it takes the load off the shoulder. On our top right, you can see this is one of my favorites. This is web cut taping of gastrocnemius. If the patient has swelling in the calf region, and if they're complaining of increased tone and there is increased tension in the calf area, this works like anything. This is very useful. You can use it for quadriceps, hamstrings. This is web cut taping. Just below that, as you can see, they have used a complete block of gastrocnemius, which is going further till mid of metatarsus. They have used. They have gone extension, and in between this, you can see the middle one. They have tried to cover up the middle portion of the calf muscles, but depends upon you. If you want to leave it, you can. Now, this is a very important topic. Muscle imbalance. In this, you can see the weakened deep flexors, and this is upper cross syndrome, and you can use it similarly for lower cross syndrome. The weakened scapular stabilizers, retractors, and depressors, and overactive traps, upper traps, levator caps, and overactive pectoral group. That is why this forward stoop posture usually people have. So you can go for inhibition of the overactive muscle groups and facilitation of the weakened muscle groups. And I'm sorry about the picture, it's not clear because I've taken it from the book, but this is a very good example. As you can see, the scapula is elevated and there is asymmetry with head, neck and trunk. You can see this patient's neck is on the left hand side, tilted left. This is a CP patient, cerebral palsy patient. And look at the changes. And as you can see, they have actually tilted, they have taken on the right hand side, they have taken the load of the upper uh, traps and retractors, they have taken it downwards to lats and the back muscles. And as you can see on the left scapula, they have given a facilitation tape to the lower end of scapula. And the tape which is going, the upper blue one, which is going from the spine and going around the arm, I'll show the previous slide. As you can see, his left arm is a little forward. And in this slide, it is a little backwards. They have gone above the scapula and they have rotated it around the arm and they have taken the arm backwards. This is also a load shifting taping. This is a very good example. You just cannot tell from looking at the tape. You can make your own innovation. And this slide I've included because I'm a sports physio, what we do on field injury management. As we reach, because of shortage of time, there's a very little time zone we are provided with. So we have to diagnose, we have to immediately come to a hypothesis, we have to think of what to do, icing, taping, what we can do. If we cannot treat there, then we have to go out, and then you have to think about whether the player can join back the match or whether it will be possible to go in the second half. That is for the longer duration games. But if there is a shorter duration like a boxing bout or anything, then it is quite difficult to manage right there. So you have to go for a preventive measure. And you can use stretching, MET for a cramp and all, joint manipulation, and you can give a support bandage and you can send the player back. And as I always tell people, whosoever I made, the taping is an art. Do not use it as a skill. Use your own ways of innovation. Use your collaborative knowledge of other skills and techniques along with taping for your better results, for your patients, and inculcate that into your practice. And as said by Thomas Myers, muscular strain is applied along the traceable myofascial lines. This is one of my favorite because you do not work on massage. In massage, you work on muscles, and in myofascial releasing, you work on the facial sheath. So in a way, you are actually working in a broader group of muscles. So the techniques of taping, either you work on biomechanical correction, myofascial releasing, along with this, mobilization techniques, muscle energy techniques, and cupping therapy, dry needling, electrostimulation, and cryo and hydrotherapy. See, for this particular patient, she's a basketball player. She's still a teenager, and she had a strain in C6, C7. After all her assessment, I came with this conclusion. And in dodging the ball and going for a basket, she felt this jerk. She had a match day before and another match a day later. So I just had one day. So what I have done here is I have slit the tape in middle. I have cut it as I did just now, and always round off the edges. I split the tape in between, and I have just given 3 to 4 mm of gap between C6 and C7 spinous process, and I have shifted the load to trapezius, as you can see. This is my personal innovation which I've done, and she was much better after this taping. And I put this tape to take the load off and use these cups for her trigger points. And she was a lot better. After this, you can apply anything, IFT or Russian currents, whichever thing suits your treatment. Now next, these are from anatomy trains. You should include this as a part of your treatment. Now the best results of taping are in ankle sprain, shoulder muscle imbalance, as I just showed, knee issues, basically for patellar tracking. If there is tightness of IT band and TFL, you can go for myofascial releasing, and you can give a strength taping to VMO and vastus medialis. And shin splints, you can go for a crisscross tape. And muscular strains, I'll be showing now. I'll just rush through because shortage of time. Knee injuries are quite common, and as I just said, that you need to take the player out of the field immediately, or if you can manage it there, or you can send the player back immediately, then you have to work with your taping skills. Usually there is involvement of more than one ligament, and the player will always tell you that there was a giving out or maybe some kind of instability I felt while I got this. So let me discuss with ankle injuries. There is always a history of tripping or falling or dribbling in soccer, or maybe while taking off, and there is a sudden impact such as collision. There is twisting or rotating of ankle. The basic thing is price, but if you do not have time, then this one is McConnell taping, as I was talking about. This is kind of a mini fruit basket taping they're doing. What they have done is they have put an anchor just above the ankle joint, and they have gone under the ankle, and they have gone for like 4 or 5 straps, so that the ankle is in place. They have given 5 degrees of plantar flexion, as you can see, and because there is in the second picture there is a lot of swelling, you can go for web cut taping. Yes. Now this is for the treatment purpose. This middle picture, this taping is done by me. In this, as you can see, I have used a posterior glide, Mulligan's glide. In this, on your left figure, the therapist is applying a posterior pressure on the lateral malleolus. This is a Mulligan's technique. For the initial treatment of the ankle, what you can do is initially you start just giving few oscillations. If the patient is comfortable, if they're not comfortable with more than one oscillation, please stop right there, put it back in position and apply this tape. Split the tape in middle, use 3 to 4 blocks. There are blocks 1, 2, this is 3 blocks of tape. There are blocks on the tape, cut 3 blocks and split in middle. Put an anchor just anterior to the lateral malleolus and do not stretch the edges of the tape. You have to apply pressure in the middle of the tape. Put an anchor there, go backwards, maintaining the glide, and just end it just before the medial malleolus, just posterior to the medial malleolus. This is how, on your right picture, as I said, you can give oscillations if you want. This is a very useful tape. You can use it for treatment purpose or rehabilitation purpose. Now, the shoulder injuries, there are many, variations of it. Like if you're assessing the player or the patient, you will come to know GIRD, or if they fall. There are many types of injuries. You have to just work on your skills, that what you have to use. There are many techniques involved, that you have to block a particular movement, as we discussed before. There is joint laxity, then you have to provide a little bit of restriction of the movement. And if there is rotator cuff impingement, you do not have to allow the player to go for the full range. You have to block it again. And now let's come to this very useful taping, that is for hallux valgus. This is very common in flat-footed individuals, and also you will come across in many patients, general population also, mostly in females, those who have gout, and overweight individuals, they have a collapsing first MTP joint. So for this, what I've done is, this first pink tape, I have put an anchor just below the first MTP joint. I would come up and end it. I have split the tape in middle. I'll end it just above the second MTP joint. And I provide the lateral support. And this black tape, this is a facilitation tape. I started from the mid of the foot, medial side, I just followed the great toe, ended it right there. It is very useful. You can use it for general population and players, mostly with players of backache and those who have tight hamstrings. Definitely you should check for their foot arch. And if they have an arch problem, you can start an 3 to 4 blocks of tape you can use. You can put it just at the sole, and you can go upwards, you can improve the arch, and you can also combine that with this. And if the hallux valgus is quite evident and it is grade 2 or 3, what you can do is you can take a piece of silicone gel or some thermo, whatever is available, in between the great toe and the second toe. You can put it there. It is very useful. So next is SI joint strain. Again, I'm using in this my Mulligan's gliding thing. In this, we apply posterior pressure on ASIS and keeping the sacrum in place. You have to pull it towards you. But in this tape, you have to cut 6 to 7 blocks of tape. If the individual is hefty or heavyweight, then 8 to 9 blocks of tape. Use 1.5 blocks just medial to the ASIS. Put it there, and you pull it backwards and just end it in between the 2 SI joints. Or if you want to take the strain off the ipsilateral SI joint, please go across and end it on the contralateral SI joint. I repeat, if you have to take load off the ipsilateral SI joint, you can go across. As you can see in the second picture, I have ended it just before the contralateral SI joint. And this is very effective for medium pacers, whosoever complains of back pain while bowling, and footballers also, and general population also, because usually in back pain patients, SI joint dysfunction is there. Now again, a very useful thing, neck strain. In neck strain, like this is the same patient I was talking about, basketball player on your right. This is I've taken from the internet. With the help of Mulligan snags, sustained natural epiphyseal glides and natural epiphyseal glides, you use it for your treatment part. After that, if you want this to be put in place, then what you can do is you can use the back of paper. As I did not have anything then, so I just rolled it, I put it there near the epiphyses, I put it there and applied 3 blocks of tape split in middle. So the patient was much better, she was feeling more mobile, and she told me there was less of strain in her neck, which she was complaining before this treatment. Now again, for tennis and golfer's elbow, I have not shown golfer's elbow here. Again in this I used Mulligan's. I gave a lateral glide of radial head, and I just put the edge of the tape on the inner side, like medial to the radial head on the ventral side, and I went across behind the elbow, just ended it near the pointed elbow. You can go for a full cross, but that will cause the blockage of blood circulation, so it's better if you don't cross it completely. Now the wrist strains, ligament strains, and early degenerative changes in carpal bones. This left taping, this black one, usually I've come across people like in tennis players, they use this for backhand, forehand. So they have their wrist issues, their carpal bones, they have early degenerative changes in cricketers because of wrist cocking while batting. In hockey players, they complain of pain in their wrist joint. And frankly, there is no good treatment available, any treatment is available, I would say, frankly, I'll tell you. So it's better if you can go for a compression here, like this one. This is just a round tape. You have to put a band kind of a thing here. And also in this middle pick, you can go for a facilitation taping of your extensors of wrist and fingers. And if you want to split it in middle, like this black one, if you want to take the load off, you can go a little downwards and upwards, proximal and distal to the carpal bones. This takes the strain off. Also, this middle picture, this patient, she had sensitivity of ulnar nerve. So I used this. On your right, this is for dequerence disease I've used. I've lifted it up from internet, but similar I use. What I do is, I start, like these are 4 to 5 blocks of tape. I start from the dorsal side of my hand and I just cross it around the thumb, and we come up on the ventral side, end it right here. What you have to do is you have to make sure that you don't give more than 15% of tension, because if you give more tension to the tape, there is compression of tissues, and so the patient complains of more pain. So you have to reassess for sure. Again, for finger and toe injuries, this particular patient, he had a twisting injury of a little finger, so I applied a rotational glide and taped it. And this one, blue one, she was a bowler. She had a pain while keeping the ball in grip. And nowadays, because of quarantine, all of us are having postural issues. So for postural corrections, as we discussed in the CP case, this is a forward stoop posture. You can work on inhibition of overactive muscle groups and facilitation of weakened muscle groups, tightened ones. Now the precautions and to be taken during taping, and strict guidance has to be there. Always assess before and after taping, which is a mandatory thing for all users of sports tape. Injuries requiring more than tape can provide, like for example, you need something else or you need some medical intervention, please do not just rely on this, use your other skills. When taping excessively, restrict the joint range of motion of a joint, predisposing the athlete to further injury. So make sure you don't block the movement completely, and so the joint is blocked and they may have some other joint injury. Inflammation, use of adhesive and removal sprays, patients who are allergic to tape, you can use adhesive spray and removal sprays which are available. Avoid taping of on the lacerations, abrasions and blisters, and make sure you inform the player or the patient that you may have some reaction, allergic reaction, so you have to prescribe some good ointment or some anti-allergic talc. Or if you have been practicing regularly, then you should go for a patch test which is done on the ventral side of your elbow. This is the area you use. And there are some, these are some research articles I would like to share. This one says the results showed that kinesiotaping can reduce pain and improve the ratio of VMO and VL for the mechanism of patellar stability. So I would like to tell you in this, for patellar tracking, for example, if the patella is tracking laterally, you can put an anchor lateral to the patella, you can go for a split tape, you can come across medially and you can take the load off from the vastus lateralis and TFL, and you can go for a strength facilitation taping of VMO. You can start from the middle of the thigh and go downwards, which is a very useful tape. The second one is, there was a study which showed, done by our KT professionals, which showed immediate improvement in pain-free shoulder abduction after the tape application. They reduced some joint range of motion. Now, any queries if you have, please feel free. You can contact me through email also, on Facebook or Instagram. You can ask me questions here.
Dr. Priyanka, over to you. Is there any queries, questions? You're not
Hello.
audible, Priyanka.
Yes, this is like we have not much question, but one of the participant has asked that who to offload an injured muscle, like how to offload an injured muscle.
Do you
I
have
guess in
any particular muscle in your mind, or you want me to take on my own?
like participant has not
If
asked,
you can
but like
allow
we
the
have
person to talk.
no, like in your example, you have told about I guess trapezius also. You have
Yes.
offload that injured muscle. You can like tell in that case only.
I spoke about, you're talking about the basketball player I spoke about.
Yes.
Yes.
Okay. In that particular case, she had come to me before that as well, while dodging the ball, because she is in a growing stage. So her height is coming up really well. So suddenly she had an increase in height of about 4 to 5 inches in last 6 months. So because of that also, she had a lot of load on her upper back. So in that case, she complained of strain, and she told me that something was irritating her. And after I assessed her, I did all the special testing and all, nothing was going okay with her. So what I did, I thought, okay, let me take the load off her C5 and C6 and C7, because she had a referral pain in C6 and C7 dermatome. So what I did, as I told, there was like 3 blocks of tape. I split it in middle and I kept a gap of 3 to 4 mm at C6, C7, and I took off the load from that particular area, and I had given 15 to 20% of tension, not much, because otherwise there is a pull at spinous process. And I took the load off, and also you can go for this. Let me show. You can also cut off the edges like this to transfer the load. Okay, instead of just putting it like that, you can cut off the edges after splitting it in middle like this. If you are putting it on in between C6 and C7 edges, you can cut off like this. This is an X tape. If they would have done any course, they would know what is an X tape. I gave a middle split to the X tape, and I took off the load and I transferred it to upper trapezius.
Okay.
Okay, you have to give 15 to 20% tension. Yeah.
And one more question, that can we apply tape for deep muscles?
Not exactly for deep muscles, as I said that mechanoreceptors are there in superficial fascia, but yes, what you can use your other skills like your dry needling and your MFR techniques you can use. For deeper muscles, there is not much research articles, but you can use your own ways of checking it. But as of now, very little evidence of that.
Okay. And one more question, please explain the taping for edema control.
Okay. Edema control, as I said, the same principle works. I'll give you an example of calf muscle. Usually the edema is there in calf muscles. So what you can do is, you can start on the back of the knee joint, okay, popliteal fossa. You have to take 2 tapes. I'll explain again. I'll cut off pieces and I'll explain. As Let me share my screen also if you people can see. Um, is my screen visible?
Yes.
Yes. As you can see in this, uh, is it visible?
You want to share your slide?
Yes.
No, it's not visible.
Wait. Let me start. Share screen. Yes. Let me explain on this. It would be better. So as you can see on this particular slide, these are the two tapes I'll use for this. This is calf edema tape. There are these are 5 to 6 blocks of tape taken. The initial 1.5 block is not cut, and then you have to split it in 4 or 5 parts. As you can see, there are 5. Am I visible, Monica?
Yes.
Yeah.
Yes, you are visible now.
Oh, sorry, Priyanka. Yeah.
Hmm.
So there are blocks in the length of the muscle, and if you go transverse, there are lines. So you can cut it in 5. You can split it in 5, and you can leave the initial 1.5 block, which you have to put adhere to the popliteal fossa laterally, and then you have to give 15 to 20% tension. You have to spread it in 5 parts. Just you have to end it just above the ankle joint. And similarly, there is same tape you have to apply medial to the knee, back of knee joint, and you have to split it in 5 parts. You have to go medially, posteriorly, and laterally, crisscrossing. And one thing I would like to mention here is, when you tape, the tape doesn't adhere properly, tape over tape, but it adheres properly to the skin. So make sure whenever you are taping for this edema tape, you use the adhesive spray, because it will not stick properly. I have answered
The same
question.
participant has asked that what is the use of splitting this tape? What is the use of splitting
What?
this tape? What is the use
Why
of
I have
splitting
split
this
this
tape?
tape?
Yeah, yeah.
Okay. Why we have split is to provide the area in between those areas. There will be movement of lymph and blood circulation will be there for removal of edema from that particular area upwards. Because when you start from up, where you will be putting the edge, the lymph flow will be towards that particular area. The web will provide the flow of blood and lymph towards the upper end. Okay, because this is a part of kinesiotaping course, so it will be difficult to answer it in a proper elaborated way, but hope I have answered your question correctly. Where you will be putting the upper edge, there the blood and lymph will be directed towards that. The drainage will be proximally. This is kind of a facilitation edema taping.
Okay. And one more question is there, like which are the conditions where taping is the first line of management?
Taping is the first line of
First line
management.
of management, yes.
You're talking about sports or you're talking about general?
I mean,
Because
general, like,
okay, let me answer this. Generally, I do not prefer using tape as the first line of treatment. Only in cases of postural correction. Yes, postural correction. Yes, I saw your question in general. For postural correction, this is my first line of management. For CP cases, I use it extensively. For people who have poor postures, forward neck postures, I use it as first line of treatment. And in sports, I use it for muscle strains and ankle sprains the most. And there is one more question from Mr. Kundu. Can we apply taping in suture line? Suture as in an old wound kind of a thing you're asking?
yes,
Yes, definitely you can apply because there you have
definitely.
tight, yeah, the connective tissues are quite tight. So that is a very good question. We have a tape for that as well. What you do is you put a very small piece of tape in the length of the tape over the suture, and then you go crisscross. Very small pieces you have to cut, lesser than a block. If the suture is in length, for example, if suture is like this, you'll apply this and then you'll take it outwards. You will have to take one piece you'll put here and apply it like this and the other one there. So you take the tension off, but it is a long process. It will take a lot of time. It usually takes about 5 to 6 weeks, and you have to change the tape every third and fourth day because there are keloid tissues also there. The skin becomes quite tight, contractures are there near the sutures. So that is why you have to make sure that you use it regularly to get the good results.
And the final
Next,
question is like, what are the contraindications for taper?
contraindications. There are many, like for any malignant tumor, if it is there, and any person who's allergic to, who has got skin allergy, because usually patients will tell you that I'm allergic to sun, I'm allergic to this thing. So for those cases, always
Sensitive
go for
skins.
patch test, as I said. And as I can see, there is another question from Navneet. How will it heal bruise and wound if it is not applied on the wound? No, no, no. It's not used for wound. I already mentioned, not on lacerations and abrasions. Bruises, yes, it works, but not on an open wound. Bruises, again, you have to use that edema tape I spoke about, web cut.
Can we use taping in acute torticollis?
Yes, you can. There was one slide in which I showed no front of neck. They had used facilitation taping for, but that is it depends actually if the the tightness of the SCM is reached a contracture level or still it is manageable.
Uh,
But yes, you can give some relief to infants.
um, no more questions are there. Now I guess it's time for Monica ma'am to give
Can you show that slide again? Which slide?
which, which one? Which slide? Dr. Supriya, which slide? Migraine, how to apply taping. This is
No,
another question, ma'am.
migraine.
In migraine, how to apply taping.
Migraine, there are different ways, as I said, because you cannot go on scalp, but you can actually work on the adjacent muscles. As I said, you can work on the overtoned trapezius, you can work on scalene muscles, and you can work on pectorals. Facilitation or inhibition, you have to check the posture. Torticollis one. Okay, wait. Let me.
Dr. Supriya is asking for that torticollis
Yeah, I'll
one
just
slide.
show.
She's asking
I'm
for
on the
that
same
slide.
slide.
Yes.
Is my screen shared?
Yes, it is there.
Okay, now this one, this top picture, as you can see, there is a blue tape on the front of the neck. This is for sternocleidomastoid muscle. This is facilitation taping. Can you see?
Yes.
I'm moving my mouse there. This is the tape. If you can drop me an email, let me see if I have a picture of torticollis patient. I'll send it across for sure.
In that
Who asked this question?
Ma'am, how effective it is in the case of frozen shoulder? Please elaborate.
Oh, okay, frozen shoulder. Frozen shoulder, first of all, depends which stage the patient is in. Okay, and if I usually do not prefer taping much. I go for mobilization and MET and MFR techniques, and also dry needling if the patient is non-diabetic. And by tape, what I do is with tape, I give a joint support tape. I go from anterior to posterior because they usually have a lot of pain, and also I go for web cuts. They usually complain of pain in subscapularis area, and they complain of pain in their costal muscles also. So I go for a web cut there.
Ma'am, somebody is asking, like Dr. Sham, that he has seen a patient with flat foot and increased foot inversion. Can taping be added in the treatment methods for correcting the misalignment?
Yes, definitely. As I said, you can go for a hallux valgus tape, and also you can go for like eversion taping for this. I just told about. You can put an anchor uh, on the sole on the lateral end, and you have to go up and across. You have to end the tape. It's difficult to tell. Let me see if I can explain. This is the ankle thing. Hope this is visible. You have to apply the edge of the tape here, and you have to go from medial to lateral, and you have to end the tape here, just anterior to the lateral malleolus. Definitely you can use. Ankle has been my favorite topic, and I have done a dynamic analysis of foot research also. So I can tell you it works for sure. Search on you can search on like British medicine that journal, no? DSMJ. You can search on that for that. There are taping articles.
Uh, Earlier, like you were telling, ma'am,
Frozen
headache.
shoulder. Yeah.
Okay,
Headache, you're meaning only tension type of headache.
yeah.
Yes. For other kinds of headaches, you have to use MFR and your dry needling techniques, because taping you cannot apply over here. That is a limitation. Otherwise, you'll have to shave off the scalp hair if the patient allows. You can do it in case of men. Women, I'm sure they will not allow to shave off the head. Otherwise, you can work on your scalp muscles. One patient allowed me, so I used occipitofrontalis muscle. I did go for inhibition taping. Any more questions from anyone?
That was a wonderful session, Dr. Khyati. I think you have answered most of the
No more
questions.
questions are pouring.
Yeah, you have answered it beautifully. I think all
Yes.
our participants must have understood it.
Yeah.
Over to
And the
Monica,
rest,
ma'am.
more queries we can answer in the group which we have made.
Yes, and participants can mail to Dr. Khyati also. I'm sure she would reply to all of the
Yeah, you can
queries.
drop me an email and or YouTube link.
Thank you so much, Dr. Khyati. Over to
You're
Monica,
welcome.
ma'am. Thank you so much.
Yeah, it's been a pleasure. Thanks so much.
From us also. Thank you so much.
Yeah. Okay. Bye-bye.
Bye.
Right.
On behalf of IEP technical team, thank you, Kathy ma'am. Thank you so much, and thank you, IAPWC Ghaziabad team, and all participants for attending this webinar. I would also like to thank our IAP President, Dr. Sanjeev Jha sir, and IAP Women's Cell National Head, Dr. Ruchi Vashni ma'am, for providing this platform for sharing our knowledge. I request to all participants, please subscribe our YouTube channel, and you can also follow our Facebook page. Thank you.
Thank you, Dr. Madhuri.
Thank you.